It's a great day to talk rehab. Thanks for tuning in. I'm Dr. Donald DeFabio. Today we're going to be talking about strained hip flexor. See it a lot with our soccer players, our sprinters, a lot of our athletes, okay? Runners, they pull the hip flexor. So Mike's been training for his 5K that's coming up. How's your training going, Mike?
It's going.
It's going, yeah. You're built for comfort, not speed,
yeah,
huh?
A little bit.
Yeah, he's not quite. He's built for power, is what he's built for, which is great for me because he's got a great hip flexor. So let's talk about that. You could be a groin pull as well, is often confused with a hip flexor irritation. It could be your iliopsoas group, or it could be your rectus femoris. Your rectus femoris attaches from your anterior inferior iliac spine, this bone here, all the way down to the knee. It flexes the knee, the hip, flexes the hip, and it also extends the knee, all right? So our job first is to differentially diagnose what muscle's involved. And sometimes even a sports hernia can mimic a hip flexor strain. In this case, we're going to say we've analyzed it, we've determined that it's the rectus femoris that's the problem. So how are we going to treat it? Well, it depends on, is it an acute strain and we just want to ice and rest it, and sometimes that's a really good thing to do, or is it more of a chronic situation where it's tight and stiff? Let's talk about how we can treat both of those with radial pulsed wave therapy. So Mike, I'm just going to put your shorts up here a little bit. Give you a little sumo look. Great. So as I said, the rectus femoris comes all the way down. Let's say it was a relatively acute tear and it's not torn, maybe a grade 1 to 2, 25% of the fibers might have been torn, and it was in the belly of the muscle. So if the tear is here, we're not going to want to put a lot of radial therapy on that. We're going to want to go above and below it at a relatively high frequency and low bars. So I would do like, it's a thick muscle, so I would do like 1.3 bar, and I'd probably do it about 18 hertz. Why? Because I want to get a little bit of that wave. Remember, radial pulse wave is like dropping pebbles in a pond, all right? You don't always have to hit the bullseye. That wave over here, when it crashes in on the shore, could be all you really need. So let's bring this up. I'm using my Chattanooga Mobile 2 unit today. So, high frequency, 20 hertz, not too much penetration, but I can feel it right there where the lesion is. So I'm not going to go on the lesion. I wouldn't do this the same day, but I would do it on day 3 for sure after muscle pull. You could do it on day 2, all right? Day 1, you want to give that a chance to calm down. Remember, your inflammatory cascade with muscles and soft tissues, it lasts about 3 days, the initial insult. Then you want to stop that inflammatory cascade and prevent that secondary zone of injury from occurring from prolonged inflammation. So let's say this is more of a chronic situation. If it's more of a chronic situation, it's been around for a while, and it's tight, and it's stiff, he's having problems driving through when he's running, there's a pretty thick muscle. I'm going to crank this up to about 2 bar, and I'm going to drop it down to about 15 hertz. So a little slower. And you can even, I don't know if you can see it, but that marker's really dropping. And I can go right over it. Now, Mike knows the answer, and I hope you do too. If you've seen the other videos, you know. Mike, when we're doing that, we're going over a painful spot. About how much should the pain be?
5, 6 max?
Exactly, 5, 6 or max. If it's over that, back off on the bars. Or go to an adjacent area. Don't go right over it. Or increase your hertz a little bit. Because by increasing the hertz, going faster, you don't get as much depth because the tissue can't fully rebound. It's kind of weird, but that's how it works, all right? So by going faster, you're not getting that full pebbles not going in. The waves are getting shorter. I think if you're like I'm a surfer, we talk about the frequency, right, of the swell, right? The more waves that are coming in, The more waves that are coming in, the less power there generally is. The longer wavelength, the waves can really build and crash on the shore, as a rule of thumb. So, how many hits? 2,000 hits around the lesion. It's a really big muscle. I may do 2,000 hits in this area and then go do maybe 1,000 or 2,000 up at the proximal and distal attachments. Remember, when you get close to the bones, back off on the intensity and the frequency, or come in on angles. When you have those deeper tissues, you can get a little bit more aggressive. Going to be sore for a day or two after you get done. When you get done with this though, go right into some gentle active care, some squats, some terminal knee extensions. Ideally, if you can do some eccentric loading on the muscle, that would be perfect. Some kinesiology tape also afterwards, and keep it mobile, keep it lengthened with slight tension. Stretch bands, TheraBands are really perfect for that. That's how you would treat a hip flexor strain in both the acute and chronic cases using radial pulse wave therapy. Check it out, it works great. I'm Dr. DeFabio. Thanks for tuning in.